My name is John McKeon, and I'm the moderator of the Teradata Aprimo River, Teradata and Aprimo's largest customer community. You can connect with us at teradataRiver2.com. Today, we are speaking with Mike Kasel, healthcare analyst for the BlueCross BlueShield of Minnesota, a huge BlueCross BlueShield, 2.8 million members. And Mike will be speaking at this year's Partners Conference with a session entitled A Geospatial Case Study for BlueCross BlueShield of Minnesota. Mike, welcome to the river.
Thanks.
Mike, tell me a little bit about the geospatial case study that you'll be talking about. What was the impetus behind actually starting this case study?
The case study I'm looking at is called Health Services Delivery Tables, or HSD tables, and that's a government reporting requirement. With healthcare reform, we anticipate a lot more of this reporting requirements in the future. So the HSD tables are two tables of our provider network and our facility network that will demonstrate to Center for Medicaid Services, or CMS, our network to prove that we can provide coverage for Medicare Advantage eligible members within Minnesota.
Well, Mike, what does this environment give you relative to the old environment? I know we were talking a little bit earlier about looking at things from a member level versus a provider facility level. What's the change in this?
Yeah, so with the speed of Teradata, I'm able to switch my analysis from kind of looking at a coverage or a facility and a provider, how far they cover, to more of a member-centered analysis, more detailed, where I can look at each individual member and locate the nearest facility and see if it is within the required distance by CMS to be eligible for our networks.
So, Mike, what type of benefit does this give your organization, and what type of benefit does it also give the members from a time perspective, from a benefit perspective, and maybe even from a cost savings perspective?
There's quite a time savings on BlueCrosses, and as far as reducing a lot of time, instead of looking at making maps, looking at the coverage of our networks. For the case study that I'll be presenting, we'd look at almost 4,000 maps. Maps are great to look at, but in this case, we're just looking at submitting raw tables, and we don't need the maps. So this creates a lot of time savings for us. We potentially save some money by not needing to hire a consultant to do this work. There's also, we can look at membership and the fact that failure to comply for these requirements would be loss of product, loss of membership. So in the end, loss of money and revenue for BlueCross of Minnesota.
Well, Mike, what about the speed of processing in this new environment? What kind of changes did you see?
Quite a bit of increased production with the speed of Teradata and using the geospatial. In my case study, I looked at doing a cross-product join and comparing 1.5 billion comparisons of member and providers, and took under 2 minutes to do all the processing, where if I were to do this manually, doing this the old map method, I've calculated at 4,000 maps and roughly 45 minutes a map, and that would end up to be over 2,800 hours or 360 days. So that's quite a savings there, time savings.
Mike, what about the future of this? I mean, you're doing some really interesting things now. What about the futures, such as visualization of the data and really putting it in a test environment? What type of what-ifs could you create that you wouldn't be able to do before?
In this case study, we used the data labs that Teradata has. It was a great test environment, and now I'm looking to get this in the enterprise and to the production database, where this can be used enterprise-wide at BlueCross. And then also with that step, we would be able to do some of the visualization that we're looking at with some of the web mapping software and get some web maps where we can actually display our members and networks. And then some of the other analysts in the company can look at how providers and networks compare. That's kind of the next step.
Mike Kasel, a healthcare analyst for BlueCross, BlueShield of Minnesota. Should be a very interesting discussion at Partners when he talks about the geospatial case study that they did. Mike, we'll look forward to seeing your session at the Partners Conference.